World Language Access Network. My name is Leon. What language would you like?
Leon, I need an interpreter for Mandarin Chinese, please.
Sure thing. Please hold, okay?
Thank you.
A few months ago, we started on a journey to look for a solution to better meet the needs of some of our patients who have an emergent need for interpretive services.
In the past, we've had to rely on live interpreters, which even in a city the size of Lincoln, with the different communities we have available, can still be difficult.
We were looking at other ways of improving our interpretive services, and our staff got together and looked at a variety of different avenues of how we could improve that communication between our patients and the staff.
When we searched for that, what we found was a video remote interpreter. We call our little machines Marty. We have several of them. Marty's on wheels, and he goes from room to room. What we found is that this has been widely accepted by our staff, by our physicians, and also by our patients because it is so readily available.
We found the video remote interpreter to be very helpful in that we can get an interpreter online within just a minute or two.
While we realized the benefit of in-person interpretation, what we didn't have was rapid access to those interpreters, especially for emergent needs and middle-of-the-night calls, and sometimes just for short interactions. And it also fills the need for the deaf and the hard of hearing.
I've just in the past 8 months been able to get Mandarin Chinese, Ukrainian, and Spanish interpreters, just to think of a few, and they've all done a very good job. In all of those cases, the patients and I have been uniformly happy with the quality of interpretation.
The nurses really drove this process very well in the fact that they enjoyed using it, they found it very easy to use, to bring to the bedside to use, and their conversations can take anywhere from 1 minute just to ask a simple question to the patient or the family, or several minutes where they're doing discharge teaching, they're doing longer conversations related to plan of care, next steps for homegoing, all those kind of issues actually can be very well interacted through the Marty device and the provider.
It's really important that we have trained interpreters, and that's one of the benefits of Marty, is that we have such ready access and that we know that these are medical interpreters that understand what we're asking them to say. Patients have been very accepting of this. They don't want to let this go. They like to know that if they need interpretation, it's going to be there for them.
I'll tell you, I'm so proud of our staff in the way that they've identified what was an issue in communication between people that English isn't their first language. And they put a team together and said, we have to address this because they're looking again after the quality and the safety of the patient. And this was their solution to assure that we had the proper communication.